Hello, in this health sketch we want to talk to you about stroke. It's a bit of an odd name, stroke. It certainly has nothing to do with tennis strokes, swimming strokes, or brush strokes. The word stroke comes from the idea of receiving a strike or blow, as that is how quickly strokes appear. All of a sudden, people are struck by this illness. Did you know that every year more than 15 million people worldwide have a stroke? Of these, 5 million die and another 5 million are left disabled. Whilst most strokes occur in people over the age of 65, they can occur in much younger people too. But what exactly is a stroke? The brain, like all parts of the body, needs oxygen, which it gets from the blood. A stroke happens when blood flow to the brain is cut off. When brain cells are starved of oxygen, they become damaged, and the symptoms that follow are called a stroke. As the brain controls the whole body, the symptoms of a stroke can be wide-ranging, depending on which parts of the brain are affected. If the stroke occurs here, it would cause a drooping face. Here, weakness in the arms or legs. Or here, difficulty speaking. Other symptoms can happen too, like changes to vision, loss of balance, confusion, and memory loss. The effects might be barely noticeable, but are more often severe and disabling. Sometimes these changes can be reversed if treatment is started early. That's why it is so important to act quickly if you suspect a stroke. Remember, you need to get help fast. F is for face. Is their face drooping on one side? Can they smile? A is for arms. Is there weakness in the arms? Can they lift them both up? S is for speech. Is their speech slurred? T is for time. If you spot any one of these signs, then it's time to call an ambulance. Once the ambulance arrives at the hospital, a doctor will assess you and arrange an urgent scan of the head, which shows where the brain is damaged and what type of stroke has happened. Strokes are put into two groups depending on the problem in the blood vessels supplying the brain. There can either be a blockage, called an ischemic stroke, or a bleed, called a hemorrhagic stroke. The majority of strokes are blockages. It's important to identify early on which sort of stroke has happened, as they each have very different treatments. Blockage strokes are commonly caused by the buildup of fatty material in blood vessels. This fatty buildup may lead to a